Which component of a CT scanner rotates around the patient during image acquisition? A. X-ray tube. B. Gantry. C. Detector array. D. Console. What is the purpose of the CT scout image? A. To provide a preliminary diagnosis. B. To perform a dose check. C. To assist in patient positioning. D. To calculate contrast injection rate. Which type of contrast agent is commonly used in CT scans to enhance blood vessels and soft tissues? A. Barium sulfate. B. Gadolinium. C. Iodine-based. D. Iron oxide. What is the purpose of using a convolution kernel in CT image reconstruction? A. To adjust radiation dose. B. To reduce patient motion. C. To improve image quality. D. To enhance spatial resolution. The quantity of detector rows X size of each detector is section width. For example, 64 times 0.625 is 40 millimeters. Beam collimation number of detector rows equals detector collimation, where 0.625 is equal to 40 mm64. A. Desired quality in a CT detector, high dynamic range. B. MSCT beam collimation consists of beam. C. MSCT beam collimation consists of post-patient collimation. What type of CT scan is often used for assessing coronary artery disease and cardiac anatomy? A. Axial CT. B. Helical CT. C. Cardiac CT. D. Perfusion CT. What part of the CT gantry measures photons that are transmitted and pass through the patient? A. Detectors. B. Filters. C. Slip rings. D. Collimators. What type of CT imaging is typically used for visualizing blood vessels with high contrast resolution? A. Partial volume effect. B. Streak artifact. C. Beam hardening artifact. D. Cupping artifact. Which type of CT imaging provides real-time assessment of tissue perfusion and blood flow? A. Dual energy CT. B. Multiplanar reconstruction. C. Perfusion CT. D. Cone beam CT. What does the term window width refer to in CT image analysis? A. Adjusting the display brightness. B. Adjusting the display contrast. C. Adjusting the image rotation. D. Adjusting the field of view. A digital radiograph was produced while the patient bed was translated through the gantry, maintaining the X-ray tube and detector array in place. A. What does a SSCT and MSCT require? B. What is a scout image in CT? C. What is the purpose of flying focal spot technology? D. What is the purpose of an scout image in CT? Which material is used in CT phantoms to simulate human tissue? A. Water. B. Metal. C. Air. D. Plastic. What is the purpose of a CT scout image? A. To detect metallic implants. B. To estimate patient size. C. To preview the anatomy. D. To measure bone density. Which imaging technique can provide information about blood flow and perfusion in addition to anatomical details? A. Positron emission tomography. B. Magnetic resonance imaging. C. Single photon emission computed tomography. D. Dynamic CT perfusion. Which type of CT scan is specifically designed for imaging the coronary arteries and heart structures? A. Abdominal CT. B. Head CT. C. Cardiac CT. D. Pelvic CT. What is the purpose of a CT collimator? A. To shape the X-ray beam. B. To adjust image brightness. C. To enhance contrast resolution. D. To reduce patient dose. Non-contrast CT brain, anticoagulated patient with right hemiparesis and abrupt onset of disorientation. What does the picture depict? A. Intraventricular hemorrhage. B. Subdural hemorrhage. C. Enhancing mass. D. Calcification of the choroid plexus. E. Epidural hemorrhage. What is the role of the CT gantry in the imaging process? A. To generate X-rays. B. To rotate around the patient. C. To measure radiation dose. D. To adjust image contrast. What does the term slice thickness refer to in CT imaging? A. The width of the gantry. B. The spacing between slices. C. The size of the patient. D. The strength of the X-ray beam. In CT imaging, what does the term slice thickness refer to? A. The width of the X-ray beam. B. The height of the detector array. C. The distance between adjacent slices. D. The diameter of the gantry. Which of the following technical aspects directly affects the dose given to patients? A. Algorithm. B. Matrix size. C. Window level. D. Milliampere second. Which type of CT scan involves acquiring images at multiple time points to visualize the distribution of contrast agent in tissues? A. Dynamic CT. B. Perfusion CT. C. Virtual CT. D. Multiplanar CT. Which type of brain lesion commonly presents as a ring-enhancing lesion on contrast-enhanced CT? A. Cyst. B. Glioma. C. Hematoma. D. Abscess. What is the purpose of contrast bolus tracking in CT angiography? A. To minimize patient motion. B. To monitor contrast agent injection. C. To improve image resolution. D. To enhance the patient's comfort. For what group have weight-based CT protocols with color coding been established to help lower patient doses? A. Adult. B. Geriatric. C. Low income. D. Pediatric. What is the primary advantage of multi-slice CT over single-slice CT? A. Higher spatial resolution. B. Lower radiation dose. C. Faster scan times. D. Improved image contrast. Which of the following signs may a patient in shock display? Which infection control measures are necessary at the site of an intravenous injection of iodinated contrast media? A. Surgical asepsis. B. Contact isolation. C. Enteric precautions. D. Medical asepsis. What is the purpose of the CT couch indexing feature? A. To adjust image contrast. B. To synchronize with the patient's breathing. C. To move the patient through the gantry during scanning. D. To increase the tube current. What is the primary advantage of using contrast enhancement in brain CT imaging? A. Improved spatial resolution. B. Reduced radiation dose. C. Enhanced visualization of blood vessels. D. Faster image acquisition. Which parameter is controlled by the milliampere second setting in CT scanning? A. Slice thickness. B. Tube voltage. C. Radiation exposure. D. Image resolution. Which CT imaging technique provides detailed information about blood flow and perfusion in tissues? A. Dual energy CT. B. Multiplanar reconstruction. C. Perfusion CT. D. Cone beam CT. Which type of CT scan is commonly used to assess bone density and diagnose osteoporosis? A. Helical CT. B. Multi-detector CT. C. Dual energy CT. D. Dynamic CT. Which of the following signs may a patient in shock display? A. Tachycardia, rapid heart rate. B. Cyanosis, discolored skin. C. Rapid, shallow breathing. D. All of the above. What is the purpose of a CT scout image in patient positioning? A. To determine optimal contrast dose. B. To assess motion artifacts. C. To provide a preliminary diagnosis. D. To outline the scanning region. Beam collimation and detector collimation settings determine the section width in the MSCT system. A. SSCT beam collimation consists of B. collimation detector collimation. C. MSCT beam collimation consists of. D. MSCT beam collimation consists of post-patient collimation. What is the purpose of CT perfusion imaging? A. To assess bone density. B. To visualize blood vessels. C. To monitor contrast injection. D. To evaluate tissue blood flow. Which type of contrast medium is often used in CT imaging to enhance visualization of blood vessels and other structures? A. Barium sulfate. B. Gadolinium. C. Iodine-based. D. Iron oxide. What is the purpose of the CT reconstruction process? A. To remove artifacts from the images. B. To convert raw data into an image. C. To enhance the spatial resolution. D. To increase the radiation dose. Iodinated contrast material is frequently injected intravenously at the following sites. A. Antecubital vein. B. Cephalic vein. C. All of the above. D. Basilic vein. What is the primary advantage of using a higher tube voltage in CT imaging? A. Reduced patient dose. B. Improved spatial resolution. C. Enhanced image contrast. D. Faster scan times. What is the typical Hounsfield unit range for normal brain tissue on a non-contrast CT scan? A. -100 to 100 HU. B. 0 to 50 HU. C. 100 to 200 HU. D. 200 to 300 HU. What does the term windowing refer to in CT image analysis? A. Adjusting the field of view. B. Applying a convolution kernel. C. Changing the display brightness and contrast. D. Enhancing image sharpness. Which of the following is an advantage of CT over conventional X-ray imaging? A. Lower radiation exposure. B. Faster image acquisition. C. Better soft tissue contrast. D. Portable equipment. What is the term for the phenomenon where a single tissue appears with different densities in different CT images due to varying X-ray attenuation angles? A. Partial volume effect. B. Streak artifact. C. Beam hardening artifact. D. Cupping artifact. A patient having a history of an allergic reaction to iodinated contrast media may undergo the following procedures in advance of a contrast-enhanced CT scan. A. Administration of a negative contrast agent. B. Premedication with steroids and antihistamines. C. Refraining from urination for 2 hours before the examination. D. Increase in fluids for 24 hours before the examination. Which artifact occurs when an object is positioned partially in and partially out of the skin field of view? A. partial volume artifact. B. Metallic artifact. C. Motion artifact. D. Beam hardening artifact. Which type of brain imaging is most useful for assessing the presence of calcifications? A. Magnetic resonance imaging. B. Computed tomography. C. Positron emission tomography. D. Ultrasound. Which factor contributes to the occurrence of motion artifacts in CT imaging? A. High radiation dose. B. Fast scan times. C. Slow heart rate. D. Sedation of the patient.